Hello, come in, welcome to my dear friend Dr. Watson's surgery. My name's Miss Nightingale, nice to meet you. Dr. Watson's not here at the moment, I'm afraid. He's terribly busy at the moment helping all of the poorly people. Dr. Watson, you see, is one of our key workers. Have you heard that word before? A key worker is a person that is providing essential services or goods at this time of national crisis. So, of course, the brilliant doctors and nurses, then the paramedics, the midwives, the hospital cleaners, the postmen and women, the delivery drivers, the supermarket workers, the police, and the teachers. Yes, your education is especially important. And of course, the many people helping the vulnerable, the people that we don't really want to catch this terrible illness because they aren't strong enough to fight it. In the care homes, or perhaps our elderly vulnerable neighbours. Have you been clapping and making lots of noise outside every Thursday evening at 8 o'clock? We must shout out loud and clear to say thank you to Dr. Watson and all his colleagues at the NHS and all the other brave souls who are working so hard now. So you make sure you show your appreciation on Thursday evening, won't you? Dr. Watson's exceedingly kind. He lets me do my studies and investigations here in his surgery when he's working at the hospital. He has many useful books here in his library, but none of them says anything about coronavirus. That is the name of the terrible illness that the world is fighting at the moment. Coronavirus, also called COVID-19, is a brand new illness, a virus that can make people terribly ill. Look, here is a picture that Dr. Watson has found for me. Fascinating what you can see through a microscope that's so tiny you couldn't see without one, just with your eye. As it is a new virus, the doctors and scientists are having to work incredibly hard to understand it, to work out how to care for people infected by it, and most importantly, how to stop it. The scientists are at the moment trying to produce a vaccine for coronavirus to keep us all safe. What's a vaccine? A vaccine is a special medicine given to people to help their immune system fight off a specific infection. It's made using parts of the virus so that the immune system is stimulated and knows how to fight that shape of infection, but it doesn't get the whole infection. A vaccine is like sending your immune system to the army, so it is trained to fight an enemy. It is prepared, trained and ready, should that virus ever appear, to fight it off effectively. The scientists haven't solved this problem yet. They are still doing lots of tests and experiments in their labs, but are certain that they are getting awfully close to making this new vaccine. Now, until the vaccine is ready, what do we need to do to keep ourselves safe and stop catching and spreading this virus? We must be hygienic. What does that word mean? Hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. So, if we're being hygienic, we are keeping ourselves healthy and helping to keep others healthy. And I'm sure you all know the answer to this. What is the most important thing that we must do to be hygienic? Wash our hands. You must wash your hands after using the toilet. Wash your hands after you blow your nose. Wash your hands before you eat your food. Wash your hands after feeding or cuddling your pet. Wash your hands before and after treating a cut or a wound. Washing at these times should be obvious. Now we must be even more hygienic and careful to avoid spreading the disease. Washing your hands more regularly, especially if you've been outside or perhaps with your mother or father for essential food shopping, is now recommended by the government. Washing your hands correctly removes dirt, viruses and bacteria to stop them spreading to other people and objects, which can spread illnesses such as food poisoning, flu, diarrhea or coronavirus. So, how do you wash your hands correctly? I am going to show you. The NHS has produced an extremely helpful guide. I've always been a firm believer in cleanliness. I would have liked this guide when training my nurses in the Crimea. Here I have a bowl of clean water. This doesn't have to be hot. Cold is fine as well, but you do need soap and a clean towel, both especially important. And these are the movements that you have to do to wash your hands correctly. Practice so that you remember them. And whilst you are washing your hands, you must remember to count to 20. Count correctly, not fast. The best way to do it is count 1 elephant, 2 elephant, 3 elephant, and so on. And then you know you'll have washed your hands for 20 seconds. Get lots of soap on your hands and start by rubbing your hands together. 1 elephant, 2 elephant, 3 elephant, 4 elephant, 5 elephant, 6 elephant, 7 elephant, 8 elephant, 9 elephant, 10 elephant, 11 elephant, 12 elephant, 13 elephant, 14 elephant, 15 elephant, 16 elephant, 17 elephant, 18 elephant, 19 elephant, 20 elephants. Nice and clean. Good rinse and towel dry. Cleanliness has always been incredibly important for health. It's something that I have understood throughout my entire life and insisted upon, alongside good ventilation and sensible, well-cooked food. Cleanliness is next to godliness. I am a deeply religious woman of the Christian faith, and indeed all religions have strong traditions showing the importance of bathing and cleaning to maintain good health and long life. It is not just in religion, however, that the benefits of cleanliness have been acknowledged. The ancient Egyptians would bathe regularly. The Romans created baths for public use and sewer systems to rid towns and cities of waste. Cleanliness has been understood for centuries, so it has always confused me greatly how the army could have allowed the shocking conditions of Scutari Hospital, where I was stationed as a nurse during the Crimean War. The army was very poorly prepared for the outbreak of hostilities in the Crimea in 1854. The Barrack Hospital at Scutari was structurally unfit to be a hospital. It was not intended for use as a hospital and should never have been used as one. For one thing, it had defective drains. Yet Dr. John Hall, Inspector General for Hospitals, gave it a glowing report when he visited. I nearly died of Crimean fever whilst I was there due to the unhygienic conditions. This was a bacterial infection, but so many more illnesses took the lives of men who should have recovered from their wounds and been sent home. 7 times more men died from infections caught at Scutari Hospital than from their wounds. Would you be interested in seeing Scutari Hospital? Shall I take you there? Follow me.